Lignocaine is used as a local anaesthetic and is used prior to IV cannulation, and especially for those anxious patients and children. Before I use the lignocaine, I want to gain consent from the patient and also ask whether they have any allergies, especially to medication. I'm also going to swab the site directly above the vein that I'm going to get access to, and I want to swab in a circular motion, always moving out. And also I've got my lignocaine here, so I'm just going to drug check. 1% lignocaine, expires July 2020. Ty, can I just get you to check that for me?
Yeah, 1% lignocaine expires July 2020.
Awesome, thank you. And I've also got here my 3ml syringe and my drawing up needle. So I'm just going to attach that and open my lignocaine. I just want to draw up 1 ml of lignocaine. Cool. I'm just going to recap the sharps, the blunt needle. And I'm using a 27 gauge sharps needle, but you can use 25 or smaller. And so just remove my blunt needle and attach my sharps. So now I've gained the consent of the patient, and before I go in, I want to remove the cap, sharps out. I want to traction, and I want to go in at a 15-degree angle above that vein or directly next to it and just under the skin. And before I start injecting the lignocaine, I just want to aspirate, making sure that I'm not in a blood vessel. Not in a blood vessel, so I want to start injecting it and ensuring that I get a 4 to 5 ml pleb just under the skin. So I ended up injecting all that 1 ml, and I want to remove it and put it straight into the sharps container. And I'm just going to make sure to watch the patient just to make sure there's no adverse effects, and I also want to wait 1 to 2 minutes before I gain IV access so that the lignocaine can work. I used all my lignocaine in my syringe, but if I didn't, I could put a sticker on the syringe and just say what drug it is, what amount it is, and so I could use it again. And also I want to write down what drug, when I used it, so the time and where I used it and the amount, and put it in my patient report form.